Hello, welcome to my channel. So today it's going to be a quick video about 10 points on macrolide antibiotics. Let's go. Macrolides are broad spectrum. They have coverage on both gram-negative and gram-positive microorganisms. They are bacteriostatic. That means they just stop the multiplication of the bacteria. Now, even though they are broad spectrum, they have more coverage towards gram-positive, but they're also effective against Mycoplasma, Legionella, and Chlamydia infections. Now, I had done a video regarding aminoglycoside antibiotics. I have added the link in the description box. Now, these macrolides are resistant to Enterococcus species, and macrolides mechanism is that it reversibly binds with 50S ribosome subunit and inhibit protein synthesis. So, since it's a reversible binding, it's having a bacteriostatic action. In high concentrations, macrolides can be bactericidal also. Macrolides are used as first-line drugs in atypical community-acquired pneumonia, H. pylori infections, chlamydia, non-specific arthritis, and pertussis. Now, let's see which of these macrolides are used as first-line drugs. In case of atypical pneumonia, we use amoxicillin with erythromycin. In case of H. pylori infection, where we give triple therapy, we use clarithromycin as the macrolide antibiotic. In case of pertussis or whooping cough, we have erythromycin as the choice of antibiotic. In case of STDs, chlamydia infections, and urethritis, we have azithromycin as the choice of drug. Now, this particular class of antibiotics are available in all dosage forms like tablets, capsules, injections, oral suspension, eye drops, and topical application. I didn't add doses here because if I add, it's going to be a long video. Now, when patients are allergic to beta-lactam antibiotics, we can give macrolides as an alternative option. They are safe and tolerated. Now, they're also safe and tolerated in pregnancy, lactation, and in pediatrics, except in case of pregnancy and breastfeeding. Except clarithromycin, all other drugs coming in this class are safe. In case of pediatrics, all macrolides are safe. In neonates less than 1 month, azithromycin is usually used for lung infections. Coming to adverse drug reactions, just remember these 3 adverse drug reactions. So first thing, macrolides can cause GI disturbances, that is nausea, vomiting, and diarrhea, mostly seen in erythromycin. It can cause prolongation of QT interval. Now this is also seen more in erythromycin and clarithromycin. Now these macrolides can strongly inhibit hepatic metabolism. So they inhibit cytochrome 450. Due to this, they can cause a lot of drug interactions. Just mentioning few drug interactions here which are important. First thing, they can interact with warfarin, where it can increase the PT and INR. Now regarding statins, it can cause rhabdomyolysis, that is breakdown of muscle tissue. In case of antidepressants, it can cause somnolence, and in case of theophylline, it can cause again GI disturbances and seizures. In case of immunosuppressive drugs, it can elevate the serum levels of these drugs. Now coming to the last slide, did you know macrolides have immunomodulatory and anti-inflammatory effects apart from its antibiotic action? So due to this reason, it's also used in cystic fibrosis. Thank you. That's all for today. Don't forget to subscribe my channel Pharmacist Point and share this video with your friends. Thank you. Have a nice day ahead.